Today's workshop is Parents' Guide to Services for Babies and Toddlers with Special Health Needs. I'm excited to introduce you to my colleague, Karen Price, Co-Director of Family Support Education at Vermont Family Network. Thank you all so much for joining us today.
So, hello. Welcome to the Parents' Guide to Early Intervention. So, parenting is a big responsibility. Parents and other family members want to make sure their children are safe and cared for. They watch to see their children grow and develop as they should for their age. This is a big challenge. It can be an even bigger challenge when a parent knows that their child has a disability or special health need, or if they think their child is not developing like other children the same age. It is hard to know what a child should be doing and what to expect. Parents may feel alone and not know where to turn for help. Since 2010, Children's Integrated Services, or CIS, was formed as Vermont's Prevention and Early Intervention Initiative for pregnant and postpartum women and families with young children. CIS services are available to support health and well-being throughout pregnancy and postpartum. Your child's healthy growth with speech, language, movement, vision, and hearing from birth through age 3. Finding quality childcare that supports your child's and family's goals and needs. Positive social and emotional development of your child up to the age of 5. CIS services are family-centered, child-focused, and delivered through a network of providers throughout Vermont. In Vermont, Part C of Individuals with Disabilities Education Act, or IDEA, is referred to as Children's Integrated Services Early Intervention, or CIS-EI, and is responsible for the provision of early intervention services for eligible children birth up to their 3rd birthday. Early intervention services are developmental services that meet the developmental needs of the child and are selected in collaboration with the parents. The early intervention system is family-driven. Families must be involved in all aspects of evaluation and assessment, planning and delivery of services. The focus of EI services is to help families enhance the learning and development of their child and to assist in their participation in family and community activities. Parents will not be charged for developmental screenings, evaluations, the development of an individualized family service plan, or an IFSP, or a one plan, as they are referred to in Vermont, or for service coordination. Your Children's Integrated Services Service Coordinator will review with you, the parent, which services on your one plan may be charged to your health insurance. They can help you sign up for public health insurance if needed. There is a cost for the therapies included in your one plan, which could result in copays, deductible charges, or charges to your health savings account. Your insurance will be charged. Your rights as a parent include declining the use of your insurance and requesting financial assistance to help pay for services. If you do not provide consent to use of public benefits of insurance, your child will still receive services. You can apply for Medicaid or early intervention financial assistance. Your service coordinator will help you with the process. So, who is eligible for EI services? Families of infants or toddlers under 3 years of age who experience developmental delays or have a diagnosis that has a high probability of developmental delay. The term early intervention services means services that are designed to meet the developmental needs of an infant or toddler with a disability and the needs of the family to assist in the infant or toddler's development as identified by the IFSP or One Plan Team in any one or more of the following areas, including physical development, cognitive development, communication development, social or emotional development, or adaptive development. These next two slides cover the services that are available. They include audiology, assistive technology, I'm just reading from the slides, counseling, psychological, family training, consulting, and home visits, medical evaluation for diagnostic purposes only, nursing, nutrition, occupational therapy, physical therapy, service coordination, social work, special instruction, speech and language services, transportation, vision. These are the providers of the services that I went through. I will not read this slide, but I'll just leave it up here for a few seconds so you can look at the list of providers. Services are provided in your child's natural environment. That would be home and community settings where all children participate, such as childcare and other community settings where children without disabilities participate. So what is the first step for parents? Who should they contact? The first step would be to call the CIS coordinator. Referrals may also be made by doctors and others who work with very young children, such as childcare providers. As soon as possible, usually within a few days of a parent's call, you should receive a call to either gather more information or to meet with you and your infant or toddler. You and the coordinator will decide whether to continue the process and do an evaluation. For children with an established diagnosed condition where there is a high probability of a developmental delay, screening is not necessary. If your child is screened, you will receive a notice of the intent to screen your child, and your consent must be obtained prior to the start. You have the right to request an initial evaluation at any time during the screening process. For a full evaluation and assessment, there is a 45-day timeline that begins upon receipt of referral to the regional CIS-EI program. CIS-EI must appoint a service coordinator who will contact the family. CIS-EI will review and conduct a screening, and if warranted, an initial evaluation of the child, an assessment of the child and the family. The One Plan Team meeting must be held within 45 days from the date the regional CIS-EI program receives the referral for the child. Evaluations must be conducted by qualified professionals to determine a child's initial and continuing eligibility. Areas of assessment and evaluation look at your child's strengths and needs in these developmental areas: physical development, communication development, cognitive development, social or emotional development, adaptive or self-help development. An evaluation uses your child's medical and other relevant records. Testing is conducted by trained and qualified professionals, and the evaluation is based on informed clinical opinion. The evaluation includes information that a family gives. What are your child's strengths and weaknesses? Their milestones, how they interact and play with other children, and how they interact in different environments with others, both adults and children. The assessment must be done in the native language of the family and be family directed, taking into consideration the resources, concerns, and priorities that you have for your child. In summary, the One Plan is developed by a multidisciplinary team that includes you, the family. It is to be developed within a 45-day timeline and reviewed every 6 months. Your child must be evaluated annually, and the parent's written consent must be obtained for services to begin. So, who is on the One Plan team? The parent, anyone that you, the parent, would like to attend to support you, the service coordinator, evaluators, service providers, and others who may have knowledge of your child. So what does the service coordinator do? They coordinate all One Plan services and are the single point of contact for helping parents. They may make referrals to providers for needed services or help with scheduling appointments for infants and toddlers with disabilities and their families. The One Plan must include a statement of the infant or toddler's present levels of physical development, cognitive development, communication development, social or emotional development, and adaptive development based on the information from that child's evaluation and assessments. Family information, including resources, priorities, and concerns related to enhancing the development of the child. Results or outcomes expected to be achieved for the child and the degree to which progress is made toward achieving these results or outcomes. The One Plan must include the specific early intervention services, the length, duration, frequency, intensity, and methods of delivering the early intervention services, the natural environment for that child or service to the maximum extent appropriate. If other services are not currently being provided, a description of the steps the service coordinator or family may take to assist the child and family in securing these other services. The One Plan must have the initiation date for each of the early intervention services. The service coordinator, who will be responsible for implementing the early intervention services identified in a child's One Plan, including the transition services and coordination with other agencies and people. The contents of the One Plan must be fully explained to the parents, and informed written consent must be obtained prior to the provision of early intervention services. If the parent revokes consent later, the revocation is not retroactive. Parents can decide whether they want the services that are written into the One Plan. If they agree with the infant or toddler's One Plan, services will begin as soon as possible following the meeting. Services will not be provided without written parent consent. So if parents are not happy with the plan, they should indicate in writing that they disagree and ask for another meeting to talk about which services they do and do not want. The service coordinator is responsible for organizing another meeting if one is needed, and will talk to parents about their concerns to try to find a solution. There are several formal and informal ways to resolve disagreements. If parents disagree with just part of the plan, they can accept the services they agree with and reject those with which they disagree. The services they accept can begin while they resolve their concerns about others. Changes to the one plan must be made by a multidisciplinary team. Even if a parent has agreed to the one plan, they may request changes at any time if there is a need to do so. The one plan should be flexible enough to change with the needs of the infant or toddler and family members. Parents may begin this process by asking themselves several questions. Is my child making the kind of progress I expected? What changes to the services in the one plan need to be made to improve my child's development? If parents think changes are necessary, they can ask for a one plan team meeting to review the plan at any time. There are also regularly scheduled review meetings after 6 months and annually when the team, including the parents, discuss progress, what's working well, and any changes they would like to be made. So here are some tips for parents. Attend all meetings about your child. Learn as much about your child's disability and ways to support their development, and ask questions. Share what you know about your infant and toddler's development. Parents are the experts when it comes to discussing their own child. Let the team know what the family experiences with the child, including what they like or do not like, how they learn best, and when they do well. When you don't agree, talk about it. Look for compromise in ways that work for your child and family. Know your rights. Keep records of meetings and conversations about your child, and be sure to put dates on them. Put all of your requests in writing and keep copies for your records. So before I move to transition, I will just end with this guiding principle. The guiding principle of the one plan is that the family is the child's greatest resource, and that a young child's needs are closely tied to the needs of their family. The best way to support children and meet their needs is to support and build upon the individual strengths of their family. So an IFSP or one plan is a whole family plan with the parents as major contributors to its development. Transition from early intervention to early childhood special education services does have a process. The one plan team determines potential eligibility within 6 months of a child's 3rd birthday. The one plan team will coordinate with the receiving school district. While the one plan team or the EI team determines potential eligibility, the school team determines early childhood special education eligibility. With family approval, the regional CIS-EI team will conduct a transition conference for a child with disabilities who is receiving EI services and who will be exiting the EI program not fewer than 90 days and not more than 9 months before the child's 3rd birthday to discuss any services the child may receive under Part B, Early Childhood Special Education or ECSE services. The transition conference must include the regional CIS-EI one plan providers, the family, and a school representative. If a child is not found potentially eligible for Part B ECSE services, and with the family's approval, the regional CIS-EI program may convene a conference with the family and community-based providers to discuss other appropriate services that the child may receive. A child can be found potentially eligible and the school may disagree. So here are outcomes for which every state collects data to report regarding the effectiveness of early intervention services. The child outcomes are also reported for children receiving preschool special education services. So positive social emotional skills refer to how children get along with others and how they relate with adults and other children. The acquisition and use of knowledge and skills refers to the child's ability to think, reason, remember, problem solve, and use symbols and language. The use of appropriate behavior to meet needs refers to the actions that children employ to take care of their basic needs. For parents, knowing about your child's and family's rights means that someone from EI has helped you understand the process and what to do if you disagree. The second family outcome, that a family effectively communicates their child's needs, means that those involved with your child's EI services have helped your family communicate with professionals, advocate for your child, and feel part of the team. The third family outcome, that a family helps their child develop and learn, means that those involved with your child's EI services have helped your family feel more confident in your parenting skills and to do things that help your child developmentally. When the child exits the EI program, the family will be given a survey to determine the outcomes they have received as a result of EI services. So parents have the right to receive a copy of their child's early intervention record at no cost. You have the right to confidentiality of personally identifiable information, and parents have the right to inspect and review all early intervention records. Prior written notice must be provided to parents a reasonable amount of time before an EI provider proposes or refuses to initiate or change the identification, evaluation, or placement of the infant or toddler, or the provision of early intervention services to the infant or toddler with a disability and that infant's or toddler's family. What is prior written notice? That parents must be told in writing in advance about any meetings, evaluations, services, or actions that affect your child. So what if a parent disagrees? If informal communication fails to resolve an issue, parents have 3 dispute resolution options: mediation, state complaint, or due process hearing. The mediation process is voluntary and cannot be used to deny or delay a parent's right to a due process hearing or to deny any other rights, and be conducted by a qualified and impartial mediator. There is no cost to parents, and mediation sessions must be timely and in a location that is convenient for all families. The state complaint must describe what the EI provider has done in violation of the regulations, have contact information for your child and family, a proposed resolution, and filed within 1 year of when the incident has occurred. A due process hearing can be used to resolve issues regarding identification, evaluation, placement, or the provision of appropriate early intervention services to your child and your family. The due process hearing is a formal process. An impartial hearing officer serves as a neutral third party to hear both sides and issue a decision. If you are involved in the due process hearing, it is advisable to be represented by an attorney who is familiar with the special education laws. You should realize that the agency will be represented by an attorney. So thank you. These slides contain resources. So if you have any questions about your rights as a parent whose child is in or eligible for EI services, please contact the Vermont Family Network.
Thank you, Karen, for sharing such critical and helpful information to benefit our families. Before we get to questions, if there are any questions, we're going to take a short pause here to ask you to complete the evaluation for this workshop so that we can make improvements and fulfill our grant requirements. So please see the link that is now populated in the chat and take a minute now to complete that. And thank you. We have many more interesting workshops coming up, and you can find details about those on our homepage at their website, vermontfamilynetwork.org. Along with links to the previously recorded ones, we have tons of information on our website, and getting connected with us is easy. You can follow us on Facebook or join our closed Facebook page if you are a parent. We have 2 closed groups, one for all parents of children with disabilities, special health needs, and one for those with adult children. You're also welcome to sign up for our monthly e-news or check out our YouTube channel. We're here to help. Please contact us by phone or email. Thanks again, everyone, for attending, and have a wonderful day ahead.